today we have our first guest, Nurse Melanie, here with us.
Hi.
So guys, I decided to go with Nurse Melanie at first because since our first event, she was there, she showed her support, her interest, and I thought that it was the perfect first episode to start with a nurse and understand how they see mental health through their patients and everything that goes behind it also. All right, so Melanie, tell me, the first question I would like to ask is, what are the characteristics you look into a patient or someone to figure out if they have mental health issues or if they're going through something similar?
So I come from a hospital setting primarily. So when we have a patient coming in and we suspect that there's mental health issues involved, sometimes it takes them for them to get to the hospital. They're mainly in a crisis moment. So their signs and symptoms of a mental illness would be pretty much on an all-time high. It's going to be very different than when you go meet with a friend and you can sense that they're down. That's a different type of mental health. It is a mental health issue. Mm-hmm. It doesn't mean that they're mentally ill. It could mean that there's something impacting their mind. It could mean that there's something that's going on in their life, but it doesn't necessarily mean they're mentally sick. The people that are coming to the hospital a lot of the times are mentally sick. Or they're starting a new diagnosis. We can have people, there's a lot of characteristics. I deal with patients that are schizophrenic, I deal with patients that are bipolar, major depression, I have borderline personality disorders. I have all these types of disorders that we deal with, and we do have people that come in with suicidal thoughts and tendencies. Now, if we kind of keep onto the topic of COVID, COVID has actually brought out the worst in mental health, unfortunately, in every aspect. So whether you have schizophrenia or bipolar or anything, it's actually exacerbated their symptoms as what the condition is. So for example, schizophrenics will feel more isolated. It's not good for schizophrenics to be isolated or anybody to be isolated. Yeah. Bipolars can even fall into a really big depression. People who are already depressed fall into a bigger depression. We have had cases where people are coming in with, they are feeling depressed because of the quarantine that they've had to go through. So it's been common.
So even like when you see the quarantine they have to go through is, for example, they were tested positive and then they had to go through quarantine, or maybe they came back from vacation and then they had to go through those 14 days, or really like the months that we had to be isolated, everyone.
It was the months. It was the months because not everybody came back from vacation, and a lot of that, people who are mentally ill, or even, do you know what, if we have to put aside the mentally ill, with like people with mental health issues or people, COVID was enough to impact somebody's mental health. Yeah. So whether you are mentally ill or not, it was a mental impact on everybody. So everyone felt a level of anxiety or stress when it comes to that, because at the end of the day, we went through a substantial amount of loss within a rapid amount of time, which is enough for us to grieve in a very difficult way. So for example, we used to be able to go out and do whatever we want. Everything was easily accessible. All of a sudden, gone. That's scary for people. That's completely scary for people. People have to now homeschool their kids. The kids cannot even have to stop school. Like, these are things that are traumatizing for people because there was a routine that was broken. People wanted things as of yesterday, type of thing as well. Now we're taught to slow down with COVID. So the general aspect when it comes down with COVID is the big quarantine was enough to impact everybody, and the anxiety that it put everybody through. It's honestly, we have to embrace that it was normal to feel what we felt. So
that's important to say, like, it's normal to feel that way, because it's, especially with COVID, because it was a worldwide thing, it's still happening as of today. And like you said, it happened so quick. It's like yesterday we went shopping, we went to the restaurant and all that, and then all of a sudden you telling us like tomorrow everything's going to be shut down. And we never expected that to happen. Like, we were, like, some people were also laughing at other countries. They were like, it's like, oh, like, Quebec's not going to do that, or, but there you go, and this happens. So, but it's very important to say it's normal to feel that way, and it's, you know, it's part of, it's a human thing. It's a human thing, so it's very important.
It's so normal that we went through this, but it's so normal that we feel what we felt going through this. Like, COVID is not normal. Doesn't matter where it came from.
Yeah.
Does not matter. It does not matter where COVID came from. What matters is how it's impacting the world now, how it's impacting people now, and how we can deal with it. Until then, we're gonna find out our answers as to what caused it later.
Because actually, as like every month or every week, we found out a new. Oh, we thought that this would, you know, affect someone, or oh no, finally this does not, or finally this does. So I think everyone is confused about COVID.
Yeah, which is enough to impact anybody's mental health, because we were getting on social media one blast of what COVID was. And then after that, people were saying, "Oh no, it's not this," and it was scary what COVID was pictured at the beginning, and it still is scary.
Yeah,
it still is, because and some people have grown to not even care about it anymore, which is okay. It happens, but at the end of the day, like, I see a different level of COVID than the world does.
So another question for you: if someone has mental health issue, what should they do? Like, what are the steps that they should follow?
So one thing that we need to do is break the stigma. First things first, people need to learn to be more open about mental health issues. It doesn't mean you're mentally ill, it's just there's something that you need to talk about, there's something that you need to get off your chest. It's just like when you're sick, when your body's just sick one day, physically sick, and they catch a cold. Mental health kind of works like that too. Being mentally ill is one thing, but when you are feeling like you're down, or there's a mental health, you're having a lot of mental health issues, one thing to consider is talk to somebody. Number one, talk to somebody that you trust. If you don't have anybody in your circle that you can trust, or if you don't have many resources or friends or something, that happens. It's actually quite common. There are professionals that you can talk to free. We're lucky that we have these options here. So you can talk to them. There's suicide hotlines, things like that. If, let's say, for example, it feels like you're going out of control, this is where it differs and where people need to understand where to go from here, because where you feel that you're out of control is when you should be going to the hospital. This is when you should be calling 911 and saying, "I'm feeling out of control." And what I mean by out of control, it's you're actively suicidal. You feel like you're at risk of harming yourself or others. It should be known that you should be going to the hospital. But if, let's say, for example, you need someone to talk to, need a follow-up and therapy, be open to that, because going to therapy or going to cognitive behavioral therapy or talking to somebody regularly is like going to the doctor. It's not any different. You have to get a mental health check every so often. And for example, I'm somebody that sees traumas all the time. I see more gunshot wounds than gangsters themselves, type of thing. Really, it's the honest to God truth.
Yeah.
I see the aftermath of violence a lot. Is that something what normal people should be seeing every day? Absolutely not. So I work with people that go through traumas, like very intense traumas. And when they come into the hospital, we are built to just work. We have to go take care of the patient's life first and then react after. On an everyday basis, for someone to see a stabbing, a gunshot, a very bad, big medical case, it's not something that is normal to the human eye, and it's traumatic every so often. So I, just like anybody else should, I go get myself checked regularly because it's just a healthy thing to do. You have options of private, you can go public with the CLSC, there are options out there. We can always find better options. The private options have more resources in different angles, but we do have a base option of resources for psychological help.
And it's good to know that, even if, like, you don't wait for things to get bad, to go talk to someone, you just know that it's a lot for a human being to go and see all of those things, like, every single day when you work. And like you said, you have to hold back. You can't react and show all your emotions in front of the patient, because you need to do your work. So it's hard. It's not everyone that can do that. It's not everyone that can do that. Wow. Oh, but yeah, it's important to open up. And from experience, because I went through depression, and that was my biggest issue also, because I was not opening up, because I used to be the person who was like always listening to people, but I didn't want people to see me as someone vulnerable, and I didn't want to open up because I was like, nah, it's fine, I want to remain strong. But that's the worst thing to do, because that's how you just end up drowning more,
Absolutely.
So I want to know, how often do you see cases of mental health, and is there a specific season where you see more or less?
So one thing with mental health is that we do see it all year round. At my hospital where I'm at, I work in a facility where we do get a lot of psychiatric cases. So we get them from small cases of anxiety or small depression symptoms that they were concerned about, they didn't know how to react, so they went to the emergency, to very big suicidal thoughts, suicidal attempts. We have decompensated schizophrenics. This time of season where we see more mental health is holidays. So we're talking Christmas. Christmas we see a lot. And we see a lot in February. February, it's not because of Valentine's Day.
Actually, I was going to ask that.
It's not because of Valentine's Day. It's actually more because of it's that month where it's still so dark, and it's been dark for already like 4 or 5 months.
True. So
February is like the when people are crawling out of their hibernation moment. So it's we get a lot of mental health downfalls that time. It's also Mental Health Month.
Yeah.
So yeah.
That makes sense. And why December though? Because it's normally December is like joyful, it's a holiday.
But not for everybody is joyful. Not everyone's having a good holiday. Not everybody has people. Not everybody has a good memory of the holidays.
How can I say this? What are the triggers that can affect someone, that can bring him to mental health issues,
So triggers can come in various shapes and sizes. You can have somebody triggered because they're anxious when they are in public places, type of thing. And then you can have triggers where with, like, let's say if a woman was sexually abused, they would be afraid of a particular man or type of man, things like that. Triggers vary based on the person's trauma that they went through. But the most important thing is can you identify your triggers that make you anxious, that make you depressed, that make you feel that you cannot perform in your everyday life. What is that trigger and how can you conquer it? That's the most important thing. Is triggers is not something that we let it go. We have to identify them.
True. And sometimes it's like something small or something from the past that we think, we got over it, but no. And, sometimes we just ignore the triggers and we think we're fine, but then it runs back to us.
Exactly.
What advice would you give to someone who's going through something, either it's small or big mental health issue?
My best advice is find someone that you trust, that you can talk to, whether it be a friend or a professional. But the main thing is that some people with mental illness or going through mental issues may not necessarily feel that they're in their right mind to talk to somebody, or they feel that they're not worthy. There's a lot of feelings that go about, and sometimes it's hard for them to do something. Sometimes it's the people around them that has to recognize of what to do. So one thing that's really important is that if you have somebody that you know is going through a mental health issue, be able to take the time, identify and say, hey, do you need something? Hey, I brought you over some food. Hey, let's talk.
Reach out.
Reach out. Don't hesitate to reach out. Always check in on the person.
All right. Thank you so much for answering all those questions and talking more about this. So for everyone, if you have any more questions to ask us for this episode, reach out to us and we'll be glad to answer. All right. Take care.